Okay, whenever you're ready, Supervisor Carson.
I'd like to say good evening to everyone, and thank you very much for joining us for this very important discussion about our mental health, the state of our mental health these days. And we'll have an opportunity to get a presentation from a panel of experts and people who are involved in community health and mental health. And there'll be an opportunity for you to ask questions. And I want to say thank you very much for joining us this evening. My name is Keith Carson, and I happen to have the privilege of serving on the Alameda County Board of Supervisors. Currently, I'm the president of the Board of Supervisors. I represent District 5, which is Albany, Berkeley, Piedmont, Embryville, and about a third of Oakland, including West Oakland. We've had a month-long series dealing with mental health topics in partnership with our Alameda County Behavioral Health Care and a number of our community partners and providers. And I really want to say a big thank you to our community providers and partners, individuals who are directly trying to manage not only their community-based organizations or their private practices or their own businesses dealing with mental health in this particular instance, but obviously are in direct contact with people who are feeling a little bit challenged these days, have a lot on our plate, really don't know what to do, a little bit of anxiety. Sometimes I feel anxiety. Maybe it's a little bit too much coming at us too fast, and a lot of uncertainty. And we have individuals who really have an opportunity to interface directly with people who are feeling this way, kind of a loss of where to go and get services or to kind of verify that their feelings are okay. I mean, for us to have these anxieties and feel a little bit of displacement, but also being able to share with people that we're not alone. That we're all feeling this in some way or respect. I don't care if you're the president of the United States or president and CEO of a big corporation or a leader in government or running a community-based organizations or just managing your family as trying to navigate things yourself in this uncertain time period. You may have children, you may have relatives, you may have seniors that are somewhat dependent upon you or looking to you to guide them and help them and try to figure out how to deal with all of this. It's overwhelming. Let's admit it. I admit it every single day. But we have a number of experts that have been giving of their time throughout this series to assist us. Tonight's topic, we'll be talking about managing one's mental health or your mental health. And that's kind of the underlining theme for all of these, managing one's mental health. And as we get ready to set up tonight's discussion, I'm going to ask that Amy Schrago on our staff kind of set up the panelists for tonight and let us know who's going to be the panelists for the night. And I want to say a big thank you to Amy Schrago, Chief of Staff on our office, but also to all of the people who work on our staff, because they've been reaching out to make sure that we get the word out regularly about people who are more experts in providing these kind of services and being available to you. And for individuals who want to do follow-up, may not feel comfortable exposing yourself here in these Zoom community meetings, but you want follow-up, trying to help people to connect, because what we want people to know is that you're not in this alone. There are a number of aids and assistances that are out there on multiple levels. And many of them are right at your fingertips, or you can use them on your mobile device, or in some cases, we're starting to reopen and having more direct contact with people, especially as individuals are being vaccinated and navigating that landscape to maintaining and protecting one's health and that of their family. So again, I want to say a big thank you to everybody. I want to get to my boss, and I mean that affectionately, but sincerely, Amy Schrago, to kind of set up the panel for tonight. And I hope that you take notes, share this information with people who may not have been fortunate enough to be online. If you love them, you care about them, or maybe you don't really care about them, but you want them to be mentally healthy, reach out and share this information with them and the follow-up information. Amy, a big thank you, and I want to turn it over to you.
Thank you, Supervisor Carson. So tonight we're going to be talking about how you help your loved ones manage their mental health with crisis intervention and supporting people around you. And we're joined this evening by Dr. Aaron Chapman, who is an Alameda County-based community psychiatrist and educator. He is also the Chief Medical Officer for Behavioral Health Care Services and has served our community for many, many years. He's originally from New York and raised in Pittsburgh and came out here to the Bay Area to study psychiatry at Stanford, which we will forgive him for. And then also we Go Bears. We have Miss Stephanie Lewis with us this evening, a licensed marriage and family therapist, and she's the division director for crisis services at Alameda County Behavioral Health. And Ms. Lewis has over 21 years of experience working in collaboration with law enforcement and emergency services, providing crisis mental health to our community. After the presentation, we'll have time for questions from the audience. And at that time, you can either raise your hand to be unmuted and ask your question live, or you can ask your question in the Q&A box, and I'll be happy to read it to our panelists. So thank you so much to Dr. Chapman and Ms. Lewis for presenting this evening, and we will have questions when they're through.
Great, thank you.
Oh, hold on one sec.
David, I think you're on.
Looks good on my end.
Yep.
Okay.
Ready
And so
to go.
you can see the slides now.
Yes.
Cool.
Thank you. Hope everyone's having a good evening. Next slide. So I'm going to start with our mobile crisis teams that currently are providing crisis mental health services throughout the county. And Alameda County Behavioral Health Care has 3 particular mobile team models that we are running throughout the county. So the first one is our 2-clinician model. And it is 2 clinicians riding in a county vehicle, responding to crisis mental health calls, and evaluating individuals for hospitalization, but also looking to divert individuals to more appropriate and less restrictive environments. We also refer individuals to a wide range of mental health and substance use disorder services. And the information is on the screen. Though that clinician, 2-clinician model runs Monday through Friday from 10 a.m. to 8 p.m. And I should have started off by saying that all of our mobile crisis teams are comprised of licensed clinicians, and we provide mental health crisis intervention throughout the county to children, youth, and adults. Go back one. It's hopping ahead on its own. I love technology, right? All right, there we go.
Touch.
So it's very sensitive. And so our second team is our mobile evaluation team that provides mobile crisis in primarily East Oakland. It's comprised of a clinician and an officer from the Oakland Police Department, and they also respond to crisis mental health calls, and the hours of operation are there. The 2-clinician model and the clinician and officer model can be reached by calling us directly. And the number is listed. That's our headquarters, where a licensed clinician is receiving those phone calls and determining which is the best team to respond for an individual in crisis. We can also be reached by 911. The third team is our CAT team, which stands for Community Assessment and Transport Team. We're excited about this new pilot program. It's comprised of a clinician and an EMT, and responds to calls in Oakland, San Leandro, Hayward, Fremont, Union City, and Newark. And the goal of our CAP program is to reduce the involvement of law enforcement and also increase the opportunity for diversion and transportation to a wide range of services. And this team runs 7 days a week from 7:30 a.m. to 11 p.m. And so we're so excited about this new CAP program. Next slide. We also have outreach and engagement teams. So these teams are staffed primarily with people with lived experience, either family members or individuals who participated in mental health services or substance use disorder services in our county. And so our first team, Community Connections, is really focused on individuals who are not housed or insecurely housed, with the goal of assessing their mental health needs and also connecting them to a wide range of services. We work in collaboration with street health teams, the Trust Clinic, and other agencies who spend a lot of time reaching out to individuals who are living in encampments. We also have a Familiar Faces team, which is our high utilizer team. This is for individuals who have frequent contacts in our crisis services, our mobile crisis teams, and are not really securely attached to voluntary services. So we have staff who will present at a variety of locations, including hospitals, homeless shelters, primary care clinics, and just the general community in an effort to develop rapport with individuals and connect them to appropriate services. The goal is also to reduce contacts with their emergency services and law enforcement. And then our third outreach and engagement team is post-crisis follow-up, Crisis Connect. So we reach out to individuals 24 to 48 hours after a crisis event. So it could be a contact at psychiatric emergency services, John George, or it could be contacts with law enforcement or our mobile crisis team. And so we reach out to individuals to determine if they are still in crisis and if they were able to connect to the services that we referred them to. So that's our outreach and engagement teams. And it's so great to be able to just be in the community. All of our outreach and engagement teams and our mobile crisis teams have continued throughout the pandemic. So we are in the communities and outreaching to those in need. Next slide. So how do you contact our services to request a mobile crisis team? You can call us directly, and the number is listed, and you will be asking to speak to an on-duty clinician. That clinician can also provide information and guidance. So you may be a person who has a mental health need yourself, or you're trying to get care for a loved one, a neighbor, someone that you saw in the community. You can call this number, and that clinician will give you guidance on what the next steps should be. So if it's an urgent emergency situation, it may be to call 911, but in most cases, it is that one of our mobile crisis teams would be responding, or our outreach and engagement teams. So many calls are generated by law enforcement, but we receive calls directly from the general community. Next slide. So this is an example of what we try and teach all of our providers and community partners and individuals when they are calling for assistance. It's a quick way to understand the information that we need. So we need to know what's happening. So what's the situation? What's the background, if you have any? And what's the assessment? What do you think is happening? And last, the recommendation. What do you need from us? And so it's called SBAR. It comes from the medical field, and it's a great way to clearly get the information you need to us so that we can quickly deploy a team. Next slide. So crisis services response time, we often are asked, how long does it take you to get to a call? Of course, it depends on traffic, the actual situation that's happening. Our mobile crisis teams are trying to, respond within 15 to 20 minutes of receiving a call. And then our post-crisis follow-up teams reach out 24 to 48 hours and can refer back to our mobile crisis teams if we aren't able to get in contact with the person and or if the person is still in crisis. Our other outreach teams will respond within 24 hours of receiving a referral, and we will continue those outreach efforts until the person is securely connected to appropriate services. So they are not time limited. Next slide. So this is a slide about, when you must call 911 when there is a imminent situation of, involving someone who's having a mental health crisis, but the danger is imminent. And so in Alameda County, we are happy to partner with the Oakland Police Department in providing crisis intervention training to all law enforcement agencies throughout the county. And, officers receive a week-long training on how to deal with individuals who are experiencing mental health crisis. And there are times when you must call 911, and we will get into more detail about some guidance on what to expect and also what to say. But one of the things you want to do is ask for a crisis intervention trained officer and one of our mobile crisis teams if we are available. Next slide. We also have same-day urgent medication clinics throughout the county for adults. And so we have one at Oakland Community Support that's at the Eastmont Mall, Tri-City Community Center in Fremont, and also Valley Mental Health Services in Pleasanton. So these are low barrier walk-in clinics to help with evaluation for medications and also when it's appropriate refills. The goal is to divert individuals from presenting at emergency departments or to prevent a psychiatric hold whenever possible. And so there is a individual who greets the person, does an assessment, and then we use telehealth. So a psychiatrist on the screen, much like the way we're doing this presentation, is doing a further evaluation to determine if the person needs medications and writes a prescription. So we're excited to offer these same-day urgent medication clinics for adults. Next slide. We also have residential treatment programs throughout the county. So these are alternatives to psychiatric hospitalization. There's J. Mahler Recovery Center, which is in San Leandro. We have Woodrow Place, which is in Hayward. And Amber House is unique. It's in Oakland, 31st Street in Oakland, and it includes a crisis residential treatment program where individuals can stay up to 10 days, much like Woodrow and J. Mahler. But it also has a voluntary crisis stabilization unit where individuals who are in crisis but don't necessarily need to be hospitalized can voluntarily present at Amber House and receive further stabilization services, including medication and other supports to prevent a hospitalization. And so our mobile crisis teams can drop off at Amber House, and law enforcement also can transport individuals to Amber House. Next slide. And so crisis and assessment for children, we have Willow Rock, which is in San Leandro, and Children's Hospital in Oakland. Other crisis services, we have crisis support services, which is our 24-hour crisis line, staffed by great clinicians, paid and volunteer clinicians, and a lot of eager interns that work closely with our mobile crisis teams and can refer directly to us. They also have a text line for those of us who are more inclined to text than to talk. And it's pretty convenient. Every now and then I try out the number, and as soon as I hit send, someone is texting me back, asking me, how am I doing? So definitely a great resource. And of course, there's the nationwide hotline. And then the city of Berkeley has its own mobile crisis team, and those numbers are listed there as well. Next slide. Other crisis services with language specialties. So we have La Clinica and La Familia for Spanish speakers. The Asian languages are covered through our access program at Asian Health Services. And then we have additional services for those who are deaf or hearing impaired. Next slide. All right, so what Dr. Chapman is going to talk about is before you call 911, some guidance. Thank you.
Thank you very much, Stephanie. Good evening, everyone. And so I just wanted to talk a little bit about, this is, oriented toward family members or people that might be, interfacing with individuals who are in crisis in the community, particularly if we're talking about, our loved ones. And just to give a little bit of guidance to people on this call in terms of things to think about if you are engaged with an individual who's in crisis and you're trying to get help for that individual or for a loved one. So, it's going to start off, well, before you call 911, and I think, that's probably the initial gut response that many people would initially have when they're dealing with a crisis would be to pick up the phone and call 911. Ask yourself, is there an imminent health or safety risk to the individual or to someone else? Before you pick up the phone, calling 911, which is very likely to generate a law enforcement response to that crisis situation. If your determination is that there is not an imminent risk to the health or safety of the individual, to yourself, or to others around, you might want to consider calling Alameda County Behavioral Health Crisis Services, and the phone numbers here. If of course it's during the hours where that phone, where Alameda County will generate a crisis response, I think in many instances that would be a preferable approach in terms of generating a crisis service than calling 911. And if you call 510-891-5600, you can ask for the on-duty clinician, and that on-duty clinician can speak with you and can work with you to determine, what would be the appropriate team to send out for response and for support. That's not to say that there's never an instance where it would be appropriate to call 911. And just like on the previous slide, I said, if your assessment is that there is not an imminent risk, to health or safety, you might consider calling the crisis services. But if your family member or loved one is threatening to harm themselves, threatening to harm you, or another person, or is exhibiting something that appears to be violent behavior, then in fact you do need to call 911. And as I mentioned, 911 will often generate a law enforcement or a police response. It may generate a CAT team or crisis, or a crisis response. But there are some things that you can do as a loved one, even if you're in a situation where you're calling 911. You might want to specifically request that the police, that the dispatcher send a crisis intervention trained, CIT trained officer to the scene, because those are police that have gone through some specialized training, in part through our department, in terms of how to handle mental health crises or psychiatric emergencies in the field. Another recommendation, and we get these recommendations actually from talking to our police partners and to other family members, but would be to prepare your home before the responders arrive. You might want to look around and remove any items that might be used or perceived as potentially a weapon, because you really want to, as a loved one, try to de-escalate the situation as much as possible. Turn on your lights so that the responder can see, you're improving their visibility and they can see what's going on. And you might also want to reduce any distractions. So if your television's on, if your stereo's on, turn it off, because you really want the responder to be able to focus on the situation at hand. If it is possible, we always recommend that it's best to meet the police officer or the crisis responder outside before they interact with your loved one, because that gives you an opportunity, one, to help, cool down the situation, de-escalate the situation, and to give a history and to give an explanation of your loved one's behavior. We talk about the 6 W's, and be prepared to answer questions regarding the 6 W's, both when you're speaking to the dispatcher, and you may also have to, recall these 6 W's when the crisis responder or the police arrive on the scene. What are the 6 W's? Where, who, what, why, when, and weapons. Where? Well, the responders need to know where you're located and where your loved one is located. And I think many of us, including myself, sometimes assume that they know where we are based on where our cell phone is. That is not always the case. So please, let the responder know when you're calling 911 where you are located and where the situation is located. Identify the person who needs help. This is the who. The dispatcher will likely ask the name, age, ethnicity, maybe even ask what's the person wearing. The what, you're telling the responder that this is a psychiatric emergency, because by identifying it as a psychiatric emergency, the dispatcher will immediately be thinking about what are some of the appropriate resources and appropriate individuals to send to respond to the situation. The why, reiterating that this is a mental health call. And if the individual that you're concerned about actually has a diagnosis of which you are aware, you may want to share that with the dispatcher or the responder as well. The when. When did this mental health crisis happen? Is it happening right now? Maybe it happened earlier in the day. Maybe it's something that happened yesterday. This is the when. It's an important piece of information to share. And then perhaps one of the most important pieces of information to share, both with the responder or dispatch, as well as anyone who's coming to the scene, would be related to weapons. And to be very clear, to state whether or not weapons are involved in this mental health crisis, or to make it clear that weapons are in fact not involved. Because again, that can create a greater sense of comfort for the individual who's responding. When the officer arrives or when the responder arrives, tell them what you've seen, what you've heard, and stick to the facts of the situation. Explain what is happening now, because that's an important piece of information for the responder, for the officer to know what might be needed in the moment. You can tell the officer what interventions have and have not worked in the past. If it turns out as a result of this intervention, your friend or family member, the person who you are concerned about, is transported for care, you certainly want to ask where they're going to be taken. In many instances in Alameda County, that might be John George, but some individuals who might have underlying medical issues, or perhaps older individuals, they might be taken first to a community emergency room. And of course, you want to know where your loved one's going to go. Most of all, as best as possible, remain calm. Take a deep breath, and doing so, we know, will help you to speak clearly and calmly, and again, to keep the situation, controlled to an appropriate manner. This is just, a couple of additional phone numbers for our services within the ACBH system. These are not necessarily numbers for our crisis services, although they can connect you to our crisis services. We have our access program. Our access program is the central clearinghouse for our outpatient behavior, or let's say mental health services in Alameda County. I have the phone number here on the slide, and that is a phone number where your loved one can call, or you can call, seeking care, seeking an outpatient referral for mental health treatment. We have a substance use access and referral helpline that functions very much like the access line that I just described, but this would be specifically for individuals who are suffering from a substance use related condition. And what happens if you call the wrong number? Nothing happens if you call the wrong number. Our access program can get you in touch with the substance use access people. Our substance use access people can get you in touch with our mental health access program. So there really is no wrong door. But sometimes, it might be a little faster if you make sure that you're calling the right number. Our access programs work very closely with crisis services and can make a direct referral to crisis services if, as they're speaking to you or your loved one, they realize that the situation at hand is in fact a crisis. That's what I have to present this evening. Thank you very much. I think at this point, Stephanie, Lewis, and I can open the call to any questions that people might have, and I'm going to stop sharing the slide.
Thank you, Dr. Chapman, and thank you, Stephanie, for the presentation. So if you have questions at this time, you can put them in the Q&A box, or you can raise your hand so that I can unmute you and allow you to ask your question live. We will be sharing the slides and the recording of the presentation after the series, and so we're happy to send that information out. So it looks like we have a question from Damon Johnson. Would you like to unmute your mic, Mr. Johnson? Damon Johnson?
Yes, I apologize. No, I raised the hand accidentally.
Okay, no problem. So if we have any questions, you can raise your hand and I can unmute your mic, or you can post them in the Q&A box. We do have a question here in the Q&A box. Do you have recommendations for talking to a loved one you are concerned about? Not in an immediate crisis, but it's clear the person might be in a downward spiral and need professional, but without offending them or making them angry.
I can take that question. So, you know, it's always suggested that you meet people where they are in terms of, you know, your understanding of their position on mental health. And so from the language we use to the tone, oftentimes when I'm dealing with individuals who don't necessarily believe in mental health services, I talk about overwhelm or anxiety or improving the quality of their life. So I usually point out what's going well and ask them, involve them in the discussion around what would you like to improve and how would you like to improve that. In any kind of relationship, you always want to validate, then criticize if you have a criticism. So to say like, you're doing a great job kind of holding it together. But what I've noticed is that, you know, you're under a lot of stress. You seem overwhelmed or very anxious, or you aren't sleeping regularly or eating regularly, or sometimes when, you know, I'm just checking on you, you may seem to respond in a way that makes me think that you're angry. And I'm just wondering, what's your take on what's going on with you? So you want to partner with your loved one in discussing what you see and also how they're experiencing the world, you, and themselves. And then when you have that opening, start talking about what they're willing to do to improve their quality of life. And it may be something as simple as eating better every day, waking up at a regular time, exercising. And it could also include going to see a primary care doctor or a therapist or someone to talk to if saying the word therapist is going to end the conversation. I deal with a lot of individuals throughout Alameda County who are also very religious. And sometimes they feel that mental health services are in direct opposition of their particular religious beliefs. And what I always suggest that people do, I share a little bit about myself. I was raised Christian, going to church every Sunday. And what I usually say is you can pray and also talk to your therapist at the same time. You can do both. And so just really meeting your loved one where they are, using language that they would be able to sit with, and offering some suggestions, but also involving them in describing what they're experiencing. I think that that's a good way to start with individuals.
Thank you, Stephanie. We had another question asking about the Prep for Youth program, if we still have that program operating. Not sure if either of you are familiar with that one.
I can take that one. And yes, we do have a contract with the Felton Institute that does it's a very early intervention program for young people who may be experiencing some of the very early symptoms of a psychotic disorder. And it's a specialized program, and that is in fact still in operation in Alameda County. And if the person who's asking that question has concern about someone and would like to, perhaps get a referral to the PrEP program, they could call our access line, the number that I put on the slide, and that would probably be the first place, to make that connection. But that is a program that continues to operate in the county.
Great. I did see Al Gilbert, Felton CEO, was with us tonight. So that was a nice shout out there. And they're actually going to be presenting. They're going to be presenting next week at our webinar around older adult services. Mm-hmm. So our next question is from Nui O, and I know Nui is from CHA, Community Health for Asian Americans. Nui, you're on.
Yes, hi. Hello, hi, how are you?
Hi.
Thank you very much for this is wonderful presentation. We currently hiring 12 staff, bilingual staff, who is a crisis counselor funded by the Call Hope and FEMA program. So I would like to request that, especially as the Board of Supervisors here, many Buddhist, the monk who are providing services, like mindfulness services during the pandemic, but most of them are there working voluntarily. So I would like to see if many client is getting services from them directly during COVID-19 lockdown time. So in future, is there any opportunities of funding for the mental health and mindfulness services, especially meditation? That would be really wonderful. Thank you very much.
Thank you, Nui. I'm sure we can follow up with you offline about the resources that might be available to your program. And I have your contact information, so I'm happy to circle back with you about that. In the chat, we had a question: if someone is over 18, but they aren't stable in regards to drug usage affecting their mental state, can someone make an appointment for them to get help, or do they have to do it themselves and want to get help?
So definitely the person, unless it's an urgent situation, an emergency where the person fits the criteria for hospitalization as it relates to their mental health, which is complicated by the substance use. If that's not the case, then the person would have to sign up for services on their own. And it's hard for loved ones to watch individuals having a hard time with substances. There needs to be some level of desire to get some education around it. And I think that for many people, harm reduction is I wish I had a slide on it, but it's a way to introduce an idea. You plant the seed of treatment and recovery with a person. You start where they are, hopefully through education and evidence that the current drug use, for example, how that's impacting not only them, but their surroundings, sometimes gets the person to start considering treatment. And so once you start considering, then you can connect a person to treatment and hopefully they will participate. But I do know that relapse is definitely a part of recovery for many people. So it's a lifelong process for individuals, but there is no forced substance use disorder treatment.
And then we had another question in the chat: how young can a child be and be considered in crisis?
Any age. Any age. That a crisis, whether it's a mental health crisis or some kind of situational crisis, is very subjective. And so when we get calls from individuals or family members and they're saying my loved one's in crisis, you know, we're just gathering information about the nature of the crisis. We aren't questioning whether the person's in crisis or not, because it's very subjective. So if a person is feeling out of control, if things are happening and they don't know how to seek support, if they're not doing the things they used to do. For children, it can look like a child who can't participate in their normal social activities. Their peer group, they aren't interacting with their peer group, they're isolating, they're very anxious, they're not sleeping, they're not eating. And so that could be a crisis situation for a child. So there is no age limit either way in terms of an older person or a younger person. I think the youngest child that I ever had contact with and needed to evaluate for danger to self and others was a 5-year-old child. And he was in crisis, and we were able to help him and his family secure care for him, and they got better. So no age limit.
Dr. Chapman or Stephanie, do you want to share a little bit about Willow Rock? Because that's a unique resource we have in our community.
You know, we do have a crisis stabilization unit and a psychiatric health facility, which are two different sides of a program called Willow Rock. And Willow Rock is a crisis service, particularly for individuals under the age of 18. The crisis stabilization unit, I think probably for this audience, it sort of functions as an emergency room. It's a place where a youth in crisis can be brought for evaluation and initiation of treatment. The psychiatric health facility, which you'll sometimes hear people refer to as a PUF, but that functions a little bit more like a hospital. It's a little bit of a longer stay for youth who might need a little bit more longer intensive service to reestablish stability. And it's a great resource.
And it's here local in Alameda County.
Correct.
And then another question, how many crisis teams does Alameda County Behavioral Health have?
So we currently have, I have to count in my head, I should know this, 1, 2, 3, 4, 5, 6. So on most days, we have 8 teams responding throughout the county. So that involves our 2 clinician model, our clinician officer model, and then our clinician EMT model. And so we hope to expand to an additional 4 additional teams, hopefully. We are currently recruiting. So this is the first time in my tenure with Alameda County. I've been working here almost 14 years now, and it used to be 1 team, and then we expanded to 2 and 3, and now on most days we have 8. And so we're trying to get up to 12 on any given day.
Thank you. So again, if you have any remaining questions, you can put them in the Q&A box, or you can raise your hand and I can unmute you so you can ask your question. And if you're on the phone, you can press #9 to unmute yourself. Any more questions this evening for Dr. Chapman and for Stephanie? Give it a second. Looks like maybe not. Do you have any last words, Dr. Chapman or Stephanie?
I just want to say thank you, Amy. Thank you, Supervisor Carson, for the opportunity to talk about our crisis services and, and to share some information about getting help for loved ones.
Yes, and I want to say thank you too. And you can always reach out to Alameda County Behavioral Health Care Services if you have any questions. Amy knows how to get in contact with us. And we are here to serve the community and connect people to the most appropriate care. So thank you for this opportunity.
Thank you both. So thank you all for joining us this evening. Oh, I see Keith, do you wanna say
No,
something?
I just want to thank everybody from the community clinics and everyone for helping us out tonight. I hope that there was some very valuable information that individuals picked up. And if you have further questions, make sure you get back to us and ask the questions. But I'm glad that everybody came on board, and thank you. Amy, you can finish it up.
I guess I should mention, if you put your question in the Q&A box, it comes across anonymously. So if that's hampering your desire to ask a question, if you type it out, we don't actually know who it comes from. So next time I'll say that as we start to give people some more comfort. So a big thank you to Dr. Chapman and to Stephanie for joining us tonight. Like I said, the meeting is recorded, and so we're going to be posting it on the office's YouTube channel, which you can find by searching YouTube for Keith Carson District 5. We're also going to, we'll send out the link to the YouTube recording probably in the next few days after it does its magic cloud stuff. And we hope to see you again next Thursday for our final presentation in this community mental health series. We'll be focusing on mental health resources for older adults, and our presenters will be Kate Jones from Alameda County Behavioral Health. She's the Director of Adult and Older Adult System of Care. And then Dr. Lynn Trin O'Leary from Felton Institute. And they'll be sharing resources, both if you are an older adult and need resources, or if you're a caregiver or a loved one of an older adult and are looking for ways to support them. And again, if you have any questions, something you didn't feel comfortable asking, you can always reach out to our office, and we're happy to help in any way that we can. So thank you all. Have a great evening, and we hope to see you next week.
Thank you.
Thank you. Bye-bye.